Thanks for coming out today. We're really happy that you were able to make it. I'm going to introduce Marissa. She's from the fire department. She's also, excuse me, a member of TRIAD. So I'm going to let her do all the intros.
Okay.
And welcome today, and thank you for presenting this.
Absolutely. Like she said, my name is Marissa, and I work as the Public Education Coordinator and PIO with the new Lenox Fire Protection District. Today, myself, as well as Dan Turner, he is our Fire Marshal here in New Lenox. We're going to talk to you a little bit about fire prevention as well as falls prevention for older adults. So with that being said, I'm going to go ahead and turn the first part over to Dan, because he's going to be the expert in anything you ever wanted to know about fire.
Oh, it's a hard expectation to live up to. So today we're presenting a program called Remember When, and as Marissa said, it's involving fire prevention and fall prevention for elderly population. I'm going to cover the fire portion, and first off, as I said before, it's through the NFPA. NFPA is an organization that produces consensus documents, which basically are rules that someone would follow to do things the right way or to be safe. In the fire department, we follow them. They have rules about how we have to test our fire trucks or our ladders or our hose. In the civilian world, the NFPA writes rules for how they manufacture smoke alarms, as you see in this picture, for your home. They also write rules that the commercial businesses in the community follow, as far as where they have to have a fire extinguisher, how big it has to be, exit signs and those things. So that's what the NFPA is about. Also, some of this information is also brought to us statistically by the CDC, Center for Disease Control, and that's an organization that's concerned about the health overall for all Americans. So to understand the fire problem in the United States and how it relates to fire fatalities and or injuries, we have to look at some statistical numbers. However, it's kind of boring, but if you look at the chart, if you go all the way to the right for 65 and over, you can see the disproportionate the amount of civilian deaths as compared to the percentage of population. Even though the age group of 65 and over, that acquires to be 13% of the population. For this time period between 2007 and 11, the fire fatalities are way up. Okay, so that identifies that something is happening that we need to take corrective action to fix it, or try to fix it. Therefore, by reducing the amount of fatalities. It actually starts at the age 50, okay? So you can see that the fatalities are pretty high in that respect right there. The rest of them are somewhat more comparable to the percentage of population and the percentage of deaths. First thing we're going to talk about is smoking. So I don't know how many, it seems to be that more people are not smoking that we notice. But if you are a smoker and you smoke at home, you want to keep in mind, have a sturdy ashtray, and you want to dispose of your cigarette butts properly. Whether that's in wet sand, you can rinse the cigarette butts off before throwing them out. A big thing is we never want to smoke in bed. Since 2012, I want to say all 50 states in the United States have safe cigarette mandates. So those type of cigarettes, if you're not smoking, not puffing on the cigarette for a certain portion of time, the cigarette will pull itself out. But there's been many fires statistically caused by smoking and or careless use of smoking materials. So smoking in bed's a bad thing. And then in addition to that, anybody who has a medical condition that might require at-home oxygen, you don't want to smoke near the oxygen. Oxygen increases the flames in a fire. It basically accelerates it. Another safe item for fire prevention is space heaters. I don't know if anybody has space heaters here, but they are common and we do see them in the residential setting as well as some businesses. And you might see on our marquees at the firehouse, it'll say space heaters need space. Kind of sounds simplistic, but believe me, we go into places and they'll have the space heater right up against the drapes. Or they might not think about it. There might be a stack of newspapers and the space heater's right there. So although they're a good tool, they need to have plenty of clearance around them. So about 3 feet of clearance is good for a space heater. And then when you're not in the room with them, you should shut them off. And when you're going to bed, you should shut them off. Okay? And obviously, if you're leaving the house, turn them off. Fire prevention in the kitchen. Everybody likes to cook. Maybe some people don't. However, you cannot leave the kitchen while cooking unattended. So if the doorbell rings, you got to remember you got something on the stove. I know I've done that myself, cooking stuff for the kids. The neighbors come over, I'm chatting it up with them, and now I'm burning the macaroni and cheese on the stove. So it's regardless of age, you can easily forget. When cooking, you want to wear tight-fitting clothing. You don't want any sleeves or anything. So if any of you are in your robes at night making tea, you got to make sure your sleeve's not hanging over the burner. Okay. We teach, even in addition to safety for scalds and bumping into pots, you want to make sure your handles are turned in so you don't accidentally walk by the kitchen and bump the handle of whatever's cooking, and it'll go all over the floor. Therefore, you could burn yourself, especially if you have any little ones, grandchildren, or any children in your house. You got to keep them in mind too. And if there is a fire, for what you're cooking starts on fire, you want to put a lid over it. Okay. Also, you can shut the burner off, but you can put a lid over it, and that'll cut off the oxygen. If you take the oxygen away, the fire will go out. And again, don't cook if you're drowsy or had too much alcohol. I can tell you again from experience, we go to a lot of calls to where it might be an apartment building, someone had a good night, they throw in a frozen pizza, and we get called because there's smoke in the hallway. Well, someone's sleeping on the couch waiting for that pizza, and it's burning in their oven. So we've definitely seen that in the past.
One thing I was going to say about never leaving your food cooking unattended, something that you can do is take a pot holder with you or a kitchen towel or something if you're walking into another room, or maybe if you have a spoon that you're using too, carrying that with you when you leave the room so it's a reminder that, oh yeah, I have something on the stove, I need to go back and check it. Setting your timer so you hear the ding go off too, and you can bring that timer with you into the different rooms as well. So those are just a couple of ways to maybe remind yourself. I do it all the time where I'm always bringing something with me when I walk into the living room if I know that it still has a little while, or if I'm waiting for it to boil, because we all know if you watch a pot it's never going to boil. So we've all stepped away, but bringing something with you to remind you that you are doing something in the kitchen, those are just a couple simple things that you can do.
Thank you.
Yep.
You could tell I don't cook that often because I didn't think of that. This is a message I would think that we've all heard before sometime in our life. If your clothes were to catch fire, you want to stop, drop, and roll. That's easily said if everybody is limber and spry and can do gymnastics. Some of us, as we get older, it might be harder to get down to the floor. So with that being said, you still need to do it. You just need to get down slowly. And if you were unable to do that and live with a loved one, they could put a blanket on you and pat the fire out. But the best method is stop, drop, and roll. And you're rolling around to put the fire out on the ground. And of course, it says about getting medical help right away. We're going to call 911 and get us started to assist you. And if you don't need us, we go home. If you do, we're on the way or already there, okay? Smoke alarms. These are very important and save a lot of lives. They came out in the early 70s and became predominant in residential housing. I would hope everybody here can tell me they have a smoke alarm in their home, at least one. The rules on smoke alarms would be one every level of the home and one in every bedroom. In the old days, it was just one every level. So if you only have one smoke alarm each level, then you're supposed to sleep with your bedroom doors open. If you have them in your bedroom and then outside your bedroom, then you're supposed to sleep with your bedroom doors closed. And everybody knows what the smoke alarm sounds like? Has anybody tested their smoke alarm?
Yes.
How often should we be testing them? They say once a month. Okay, so that's hard to remember. So that's something you probably have to put on your calendar. And they're hard to reach, right? So we can take a broom handle or something, press it. Okay.
Quarter-inch dowel works perfect.
And that'll do it, yep, just like similar to a broom handle. The newer smoke alarms are interconnected, and you can buy them that way aftermarket, and they're wireless. In current housing that would be built today, they're hardwired and have battery backup. There's two different kinds. They have photoelectric and ionization. The basic description of photoelectric would be that one would see the smoke, if you will. The ionization, if you burnt food and just smelled that burnt smell, it picks up the burnt product and it'll alarm that way. The best type would be a combination of both of those technologies. And we can go over that after and we'll field any questions you may have. With that being said, in 2007 in Illinois, there is a requirement for carbon monoxide alarms. Okay, and carbon monoxide is a colorless, odorless gas that will basically asphyxiate you. So it's derived from improper combustion from a gas-producing appliance, such as a furnace or a water heater. And the CO alarms that are required are to be within 15 feet of the sleeping areas of your home. So if you have a bedroom on the first floor and then you also have bedrooms on the second floor, you need two of them. Okay? And those can be purchased at any local hardware store. And most of the hardware stores, the CO alarms, the smoke alarms, fire extinguishers, rescue ladders, all that will be kind of in the same area. Okay? Now this is something, when we teach children this, we call it Ediths. Exit drills in the home is what that stands for. So basically, it's knowing a way out in case there was a problem in your house. You know a way out and where you're going. The best method to do this would be draw a little layout floor plan of your house like they show in the picture. And you're going to want to, in theory, have two ways out. So one way could be the window, the other way is the door. Okay? So with that, most people are going to, we're creatures of habit, we're going to want to go out the door. But in the event you couldn't get out the window, if your bedroom is on the second floor, then you're going to want to close your door if your hallway is impassable. And you're going to have to call 911 from in your room and hang a towel or a sheet out the window to signal for us when we get there. That's if you were unable to get out the doorway and go down the hall. So, and this is supposed to be planned out well in advance before you have some type of emergency in your home. So it's something to be considered. You know, you got to think about things. And then the emergency number, nowadays we have enhanced 911. So you can call 911 from your house, not say a word on the phone. We're going to know exactly where the phone call is coming from. We might not know the problem, so you're going to have police and fire show up at your house. So you'll just get the distribution of EMS, fire, and the police. And that way we can handle whatever problem is going on. In the old days, we had the long 7-digit numbers to call 911. And then you had to remember it. And we used to stickers, put them on your phone, or you'd see them on the bottom of the calendar that you might get from church or something, all the village numbers, police, fire, that type of thing. But now it's just 911. If you were to call 911 from your cell phone, however, that is not as easily located. They can trace it down to the tower the call went out through, and they can get a close proximity, but they can't, at least to my knowledge, get it right to your house. So there's something to be said for that landline. I know everybody wants to get rid of them, but that landline always has power when you lose power, and you call 911, we're coming, we know exactly where you're at. Back to the Edith, the exit drills in the home. You want to have a set place where you're going to go. So when you come out, your other family members know everybody's meeting at the same place. So that's, whether that's your mailbox or your neighbor's front porch, if you're going to use your neighbor's house as a meeting place, notify them too. In the old days before cell phones, you'd run out of your house and go to your neighbors to call us to come to your house. Now people can do it while they're running down the stairs. They can text, and whoever else knows what they do. But so that's technology for you. But you want to have a meeting place. Okay, now this goes into, sometimes as we, in life, things change. So you want to be able to do your escape route with your abilities. And that could be whether you have to use a walker because you're hurt or you had some type of procedure or surgery. You need to make sure that the path from your bed to the dresser to out the door is good enough if now you're dependent on a walker. You don't want to think you're going to just go for it and I'll get to my cane at the end of my bed, because you might have a problem between that 5 feet distance. So sometimes it seems simple, but it doesn't always work out. So you might have to readjust the way you're doing things. So that's all the fire prevention messages. I'm going to turn it over to Marissa, and we're going to do the fall prevention, okay?
All right. Preventable injuries in older adults, specifically falls. This actually shows a chart of non-fatal injuries from falls that require help from a medical professional in 2010. And for all ages, it was 43 per 1,000. For persons ages 75, it's 115 per 1,000. So you can definitely see how right here, this part of it, that graph over there for 75 and older, it definitely jumps up there. And again, these coming graphs that you're going to see, it is non-fatal injuries. So they aren't taking into account all the fatal ones as well, or the ones that maybe we don't even know about. So the numbers could definitely be even more skewed than what they are right here. 1 out of 3 adults ages 65 and older falls each year, but fewer than half of those people actually talk to their doctors or their medical professionals about that. So that's something that through this program, as well as through Matter of Balance, that I know I'm one of the instructors for that, but we definitely talk about how one of the things that older adults need to do is talk to your medical professional. It could be your medication that you're on. It could just be that you got up too quickly and maybe that was the cause of the fall. Your blood pressure could be a little bit low. There's all sorts of different things that can cause someone to fall. So this is something that you definitely should be talking to your healthcare provider. I know many of us have probably fallen and we didn't think anything of it. And we brushed it off, we gave it an excuse, but it's something that we need to go ahead and speak up about. Even if it's just happened once or twice, just say, you know what, doctor, I just have a question. I noticed that I'm feeling a little bit dizzy when I'm getting out of bed, or if I sit up too quickly. These are some things that we should definitely be talking about, because if you have a fall, you never know if it's going to be just a slight little slip or if it could be something a lot more serious. Preventable injuries, and falls are preventable. Falls are definitely the most common cause of non-fatal injuries and hospital admissions for trauma. In 2010, 2.3 million non-fatal fall injuries happened to older adults that were treated in emergency departments, and more than 662,000 of those patients were hospitalized. Again, this isn't taking into account those who are not reporting it and those who it was fatal. So that could be a lot more than the 2.3 million, which is already a huge number for us to even think about. And among the older adults, so those 65 and older, falls is the leading injury right now, or the leading cause of death. Some of these can be fractures, traumatic brain injuries, a lot of money, long-term care facilities, death. These are all different kind of consequences that can come out of falls. again, falls can be preventable. So it is a vicious cycle because a fall tends to increase. When you fall, you start getting more nervous about it, and you're going to fear that fall. And this fear leads to your decrease in activity. You aren't wanting to get up and exercise more. And by not exercising, your mobility is going to lower and all of your fitness, which then can actually cause the falling. So it just keeps going over and over. You fall, you might become scared, you stop exercising or moving around as much, and it actually causes your muscles to be weaker, which will in turn make you fall. Not fun, is it? So one of the messages that I want to get across to you is to make sure that you're exercising regularly, because exercise does build that strength, and it's going to improve your coordination and balance. Again, some of this is, we do this through the program A Matter of Balance here in New Lenox. There's lots of different groups that you can join with the Park District or other places around the area too, where there are group exercises that you can go to. And again, you can always ask your doctor about what might be the best physical activity that you yourself can do to help you with that. Make sure that you take your time. Slow down when you're getting out of bed or when you're getting out of chairs. When you are getting out of bed, sit up, take a moment, move your legs off to the side. Just really take your time getting out of bed. That's going to give your equilibrium a chance to match up. Your blood pressure can change during that time. So that's why you really want to take your time getting out of bed and out of chairs. Stand and get your balance before you start walking then. Again, just give your body a little bit more time. And be aware of your surroundings. This can also happen if, again, with certain medications, they can cause you to feel maybe a little bit more unstable when you're getting out of bed or up from a chair, or if you've been sitting too long, so take your time. Keep walking areas and stairs clear. So you definitely want to keep those free of any kind of hazards, the electrical cords. If you're like me, you have shoes kind of laying around the house in various locations by the different doors. Sometimes I just have my flip-flops that I need to run out into the backyard with my dog, or my walking shoes by the front door, or my shoes from work by the back garage door, you know, I need to put them away more often. Clothing, sometimes if you've done the laundry and you put the clothes that need to go upstairs on the stairs, making sure that those are moved. Books, magazines, and other kinds of clutter, just anywhere where you're going to be walking a lot, or if there's stairs, you want to, again, make sure that they're clear. Lighting. Lighting can be a very difficult thing and can definitely cause falls. You want to use night lights to light your path between your bedroom and your bathroom or anywhere else that you might frequent during the middle of the night or something. That way you're going to be able to see there's a little bit more there. Always turn on your lights before you go up or down the stairs, and make sure that you're seeing your eye specialist, because there could be different things that are going on there too. But lighting is definitely something that I know I've talked a lot to older adults about, and how lighting definitely makes a difference in your perception when you're walking up or down the stairs. Some people have talked about getting automatic lights, that if you're up and maybe you're in the hallway or in your stairwell, you get an automatic light, and so it will turn on when you are going up and down. That way it's something that will help you with that. In the bathrooms, make sure you're using non-slip mats and rugs. In the shower floors, that kind of a thing, because they get really slick and it's easy to fall in the shower or a bathtub. And then you want to also have grab bars installed in your bathroom as well, on the wall of the tub in the shower or next to the toilet. That's going to help prevent a lot of different kinds of falls in older adults. And then also with that, make sure that if you spill anything in the bathroom or after you're done showering or things, just try to dry any spills or anything like that, because that's also a big cause in bathrooms of falls. Uneven surfaces, you need to make sure that you're aware, or just kind of always keeping that in your mind. throw rugs, they should always have a rubber or a non-skid backing. If it doesn't, you can actually go buy those non-skid strips that you can put underneath your rugs. I have those in my house because the rug that I bought doesn't have the rubber or non-skid backing. So it just comes in a roll with some different little slips that you can place down underneath your rug yourself. That's something that definitely helps. Always try to smooth out any wrinkles or folds in any kind of carpeting. Sometimes I know some carpeting companies will come in and re-stretch it if needed. If it's been down for a while and you notice those crinkles, they're able to do that. And then always be aware of uneven sidewalks or pavement, things like that outdoors. As we know, last winter it was crazy, it was really cold, there was a lot of snow. So even though you're used to taking that sidewalk every day, you never knew with the temperature if suddenly there was going to be maybe a new crack that you hadn't noticed before. Or the sidewalk decided to raise a little bit more or lower. So it's just something to notice when you're out walking and exercising. Just always kind of be aware of where you are and the pavement and things that you're walking on. Again, stairways should be well lit from the bottom all the way to the top. And you want to have easy to grip handrails installed the full length on both sides. I know my house and a lot of other houses don't necessarily have handrails on both sides of the stairs, so that's something to maybe think about too, because as you get older, sometimes you need a little bit more stability and it's easier to have handrails on both sides. Or even if you maybe are right hand dominant and you need that to go up the stairs, then you have to use your left hand to go down, so maybe it's easier too to have that other side. So you're using that dominant hand to help you get down the stairs. Always wear sturdy and well-fitting shoes. Low-heeled shoes with non-slip soles are definitely the best. And these are safer than high heels, of course. And thick-soled athletic shoes, slippers, or stocking feet. So safety over style is a lot of what some people say. I know we talk a lot about in the falls prevention class wearing comfortable, sturdy shoes, not walking around in flip-flops all the time, because flip-flops and other kind of sandals like that too you can slip out of. They can actually cause more falls. So with that, we're going to open up here in just a minute to some questions if you have anything about the presentation, or you can always contact myself or Dan at the fire district. We're both based out of Station 1, but we're always running around, especially this next month is fire prevention month, so you might see us running in and out of schools or businesses or all over the place, really. So you can always call us at the district, or would be happy to talk to you now.